So I want to first start off by saying that I'm going to share something with you today that I've never shared with anyone. And as I was preparing notes for my talk today, I still couldn't find the words. So I'm determined to get there. But if I stumble along the way, just be with me. There are 2 points to my talk that I want you to pay attention to. The first is I'm going to read you a haiku poem. I'm going to start my talk off with a haiku poem, and I'm going to end it with the same poem. It's a clue when you hear it the second time, you'll know I'm finished with my talk. And the second is throughout my talk, I'm going to ask a series of questions that start off with what if. So if you want to jot those down or remember them, please do. They'll help facilitate part of our discussion today. The haiku poem is entitled My Birthing Experience, and it goes like this. Entered hospital, a warrior, but returned a wounded soldier. I'll share with you my birthing experience, but first I'll start off by telling you a little bit about 2011. Walk with me. January 2011, I had finished my doctorate. I was feeling like I was on top of the world. You couldn't tell me anything. I had finally reached my dream of being a literature professor. I was on my first job, and I was working out. I hadn't reached my goal weight, but I had lost 50 pounds. I was eating healthy. I remember looking in the mirror that January one random day and saying, like, I'm here. Like mentally, physically, I'm at the place that I've strived to be for so long. And then February came, and when February came, it brought with it a couple of things. It brought with it extreme thirst, frequent urination, blurred vision. And so, because I had just moved, I said, well, I need to go see a primary care physician. And I did, and I told her, I said, I'm new to the city, but I'm constantly going to the bathroom, and I'm really thirsty. Matter of fact, I've had to move my position in church because I'm a front row kind of person. And so I told her, I said, well, I have to now sit in the back of the church near the restroom. And so I was explaining this to her, and she went down the list. No family history of anything except cholesterol. Young woman, working out. Your electrolytes are off. You need to drink Gatorade. I did. A week later, I had all my classic symptoms that I had before, but now they've increased, and they brought a couple of friends along with them. And those friends included the inability to maintain a conversation without saying some things. So I was experiencing cognitive issues. And the straw that broke the camel's back for me was when I passed out of my bathtub for an unknown amount of time. I woke up, I packed a bag, and I said, I'm not coming back to my home until someone tells me what's wrong with me. So I go to the primary care physician February 15th, and I say to her, Gatorade didn't cure me, and something is really wrong. And so she checks my blood sugar. It registers high, no number. She runs out. She comes back with a needle. Her assistant says, your glucose isn't registering, and that's not a good thing. I mean, first of all, I never want to have a medical person whisper anything to me. To be clear. So when she says, your glucose isn't registering, that's not a good thing. I'm saying, oh my God, why are we whispering? So then I whisper to my mother. I pick up my phone and I call my mother, who's a nurse in Florida, and I say, they say my glucose isn't registering, that's not a good thing. And my mother says, no, it's not. You need to go to the emergency room. When the physician comes back in with a needle, she's telling me, I need to take it, but I'm thinking, well, last week you told me about Gatorade, and that one didn't work out, so I don't know about this needle. And my mom said, I need to go to the emergency room. She and I go back and forth. She makes me sign a waiver saying that I was going to the emergency room against her wishes. I call a colleague who drives me to the emergency room. By the time I get there, I can no longer walk and stand. I'm dying. and I don't know from what. And the triage nurse says to me, how long have you had diabetes? And I said, diabetes? I didn't have diabetes. And I mean, she said it so calm, like we're cousins. Like, how long have you had diabetes? You know? And so I said, I didn't have diabetes. She said, yes, you do. I said, no, I don't. And we go back and forth, and then finally she picks up this huge glucometer. At the time, I had no idea what it was. But she said, you see this number, 593. Not only do you have diabetes, but you're going into a coma. That's why you passed out last night. And so everything I know about diabetes rushes in my head. And what I know about diabetes is that I'm going to die, I'm going to go blind, I'm going to be on dialysis, and I'm going to have an amputation. This is what I know. So I start screaming at the top of my lungs, I'm going to die, I'm going to die, I'm going to die. I'm alone, scared, terrified. And so I asked, what if? What if my primary care physician had just checked my blood sugar when I saw her the first time? What if the images and the messages about diabetes wasn't death, blindness, amputation, dialysis, all this negative stuff? How would I have felt in the emergency room? Probably not extremely terrified and alone and confused. I spent 10 days in the hospital. I started blogging shortly after that, trying to find a community, because the pamphlets were not very comforting for me. The pamphlets had images that I couldn't relate to. Number one, everyone was over 50. I was a young person. Two, they said like, oh, you get diabetes because you're fat and lazy, but I was working out and I wasn't fat and lazy, and I just didn't understand. So a nurse came in and said, looks like you haven't looked through the pamphlets. And I said, well, I looked at them, but there's nothing hopeful in them. I said, every time I flip a page, it tells me that African Americans get amputations more than someone else. African Americans get blindness more than someone else. I said, these pamphlets are telling me because I'm a black person, like, I'm gonna die from diabetes. I said, that's not helpful for me. So my education about diabetes really didn't begin until I left the hospital. And I started searching online, and I found the diabetes online community. And I found diabetes sisters and people that were living with diabetes and smiling and enjoying life. And so I began to blog because what I noticed in all of those images too, that there was an absence of black women. And so I didn't start off with that idea, but I became the most prominent African-American black woman blogger with type 2 diabetes. And I remember getting everything well. So I want to fast forward now. 60 days after that, I came home one day and I lost my home in a tornado. So I had to figure out how to manage being newly diagnosed with diabetes and having nothing. Not even a home, not a refrigerator for my insulin. Fast forward from that, it was the fall of 2011. I was now back in a home, feeling okay, starting a new semester. And I remember that I had a fibroid, but I hadn't had it checked for about a year and a half. So I decided, let me go to a gynecologist and see what's the status of my thyroid. Since I'm new, I don't know which gynecologist to pick, so I just say first come, first served. I'm fine with it. I go to my appointment, and the doctor comes in, and he opens my chart, and he says, I see you have diabetes. Are you here for birth control? I said, no. And he said, oh, okay, what are you here for? And I said, well, I have a fibroid, I haven't had it looked at in a year and a half. I want to know, like, the status of it, has it grown, or, whatever. Oh, okay. Are you sure you don't want birth control? And I said, yeah, I'm pretty sure I don't want birth control. And he said, well, when you have diabetes and you're pregnant, your baby can have birth defects, and like he starts rattling off all of these abnormalities that could happen. And at the time this happened, I was living in North Carolina, and the state of North Carolina had just decided to pay the women who had been forcefully sterilized systematically in North Carolina. And while I went into that meeting as a woman who wants to know about her fibroid, that space quickly turned for me into a space where now I'm a Black woman and a white gynecologist male is trying to give me birth control. And I didn't have the words to express what that did to me, but I had the sense enough to say, this appointment is over. But I could not let him touch me. So I walked outside in my car and I cried because I came for care and I didn't leave with any care. I left emotionally worse off than I started when I got there. When I did decide that I wanted to be a mother, it was 2014, and thank God I got pregnant. I was so happy. And my journey through pregnancy was pretty okay. No real issues. Oh, I do want to get to my what if for that one. What if that physician, when I went to him, did not try to put me on birth control, but he asked, are you thinking about motherhood? And if you are, here are resources for you to prepare yourself. What if he had said that? My favorite what if is, what if he had asked me, you have diabetes, what's your A1C? Because you know what my answer would have been? Better than yours. Because it was 5.4 and 5.5 at that time. I was living med-free diet and exercise, but he never asked what my A1C was. Never. So 2014, I am pregnant. Everything's going well. I have a couple of hypos, too many, I would say. But other than that, my pregnancy was fine. And the day that I went in to have my baby, I have a friend, she's a midwife in Texas, Happy. She told me that I needed to enter that room with a feminine energy. She knows I'm Christian, like Jesus gonna be in that room, right? So she was like, I know you're gonna bring Jesus in the room, but I need you to also bring a feminine energy in there too. So I said, okay. So she helped me prepare. One of the things that I did was I had an outfit made, and I have on a piece of it today. I put this on to help me share my story. And I actually, I've only worn it twice, both times this year since then, because I decided I'm determined to heal from my birthing experience. And so I decided to bring in Hatshepsut, a female pharaoh who had won many battles. She even dressed like a man to make sure. And so I thought, like, I'm going to be a warrior, right? That was the energy that I brought into the room. And it was a long birthing process. I had gone through a couple of OBGYNs, and the one that I was given during the birth, I went down my list of things, and I told her I didn't want an epidural, I didn't want a C-section unless it was necessary. And she returned my response by saying, we'll see about that. And so from that point where she said, you know, we'll see about that, I thought, oh, okay, I don't know how that's going to go. 32 hours later, I delivered my daughter in an emotion that I had fought for so long to avoid, and that is fear. She was determined to have a C-section. I was on Pitocin. I remember being very scared when this happened. When she said to her assistant, we need an IV. I had an IV in this hand, and I had an IV in this hand. And so whenever I had a contraction, I couldn't even do this. I couldn't even. When I asked, why do I have an IV in both of my hands? She said, because you're pregnant with diabetes. And because you're pregnant with diabetes, we can't let you move. So I'm pregnant with diabetes, trying to have a baby, and I can't even move. So I felt constrained and felt, like almost being chained. And so I said to her, well, because I have diabetes, I mean, I shouldn't not have a regular birth. And I told her, I said, you know, like, I have a particular idea of this experience. I got an outfit made. I came in here as a warrior, right? And she just said, okay. And that was it. I didn't feel like she cared about me. I felt like she just cared about getting my daughter out. And throughout that experience, I ended up going into the OR to have a C-section. She told me that she was gonna use a suction and she would only do it twice. And if my daughter didn't come out on that second time, then I would have a C-section. My husband and I were separated, and so I was in there by myself. And the fortunate thing happened was that the epidural wore off and she pulled the suction and I felt it. She didn't say anything to me. And I told myself, Phyllisa, the next time you feel that you have to push because this lady doesn't care about you. And to see this lady, you know, like she's a woman, right? And so when I felt her pull the suction, I pushed my daughter out, but I was so scared. And that was the emotion that I fought so hard to avoid. I had listened to hypnobirthing and, you know, all of these kinds of things to prepare myself. And so I often ask, what if she had put me first? What if she had asked me what my wishes were? And afterwards, I asked about my care with diabetes, and I was just told, oh, just go back to doing your regular thing. I didn't know what that meant, and you know, I'm like, okay, just life is gonna be normal, you know, after that. And so while I didn't develop diabetes from the gestational point, I came in and I experienced pregnancy with diabetes. And to be left alone after that, it was hard for me. And I often ask myself, what if someone had asked, what is your family history like with pregnancy? They would have known that I lost a grandmother after she had my uncle. And so pregnancy, there was always this association that I could die. And I ended up leaving that experience. I had a 3rd-degree burn near my vagina that was unexplained even to this day. I left that experience having hemorrhoids so bad that I've had 2 surgeries from that. And I felt very alone throughout the experience in terms of care. I needed someone to care about me. So I often ask, what if someone had just taken the time to ask me emotionally how I'm doing? Because my daughter's 3 now, and I'm still having a postpartum experience. Because it took me 2 years to heal from the birthing experience. And so I entered the hospital a warrior, but I left a wounded soldier.